This is the Art Beauty Podcast where we tell the real truth about the fake shit. I'm Amber, and today my gorgeous, stunning co-host is Dr. Rahi. She practices, I hope I get this right, integrative aesthetics, which I had no idea what that was. I still don't know what that is. We're going to ask her. Dr. Rahi, thank you so much for joining us.
Thank you for having me.
Yeah, right off the bat, we were kind of talking about this before we got on, but what exactly is integrative aesthetics? Did I get that right?
Yes,
Yeah.
exactly. Integrative aesthetics is where I merge the world of integrative medicine,
Okay.
which focuses on health, wellness, disease prevention, living optimally, and using all the different types of medicine from around the world to really bring the best medicine to my patients. And aesthetics is more on the outside, where it's focused on modifying or enhancing your physical appearance. So I really bring the two together, and I try to take a more holistic approach to what I do in my practice.
I love this. And now you're based in LA, right?
Yes. Well, I have
Yeah.
two offices actually. So I have the one in Beverly Hills and now
Oh,
in
Beverly
Soho.
Hills. Because I laugh at, I feel like I missed the boat on moving to California, but everybody I meet in California is so healthy and like so the integrative aesthetics. I'm like, yes, that makes total sense. You get to New York and people are like, just shoot the Botox into my foot. I gotta go. We gotta go. Okay. I feel great. I'm gonna go do my Zen yoga. Like, fuck off. I'm okay. That's sort of so I love that you're gonna bring a little bit of wellness. And maybe I shouldn't say that. Maybe I'm being unfair. I think people a little bit more now are trying to be a little bit more zen, but in general, East Coast is go, 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 go. And I
Yeah.
feel like West Coast is like, ah, da, da,
That's
da, da.
true, but I think I'm go, 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 go in general. I've always been, but, I love what I have been able to, like, because 'cause I'm not originally from California. I was raised in Toronto, Canada, so everything. Yeah.
Are you Canadian?
Yeah.
Oh, I'm so jealous. So I went to Montreal in 2019, in the summer of 2019, actually right around now, right around my anniversary. Yeah, it was like right around mid May. And I fell in love with it, and our plan, last year was like, okay, Canada, like Montreal. I haven't been to Quebec. I hear Quebec is gorgeous, but I was like, we're gonna start to do these things. Toronto, I'd love to get over to Toronto, but I was like, we're gonna start to do Canada.
Yeah.
Like that's gonna be a summer trip, and like right now, they've closed their borders too.
It's
Um,
insane. Yeah, I can't really go see my family, but there's different ways around it.
well,
It's just
because
not
are you a citizen?
of America? No, I have a
No,
green
no,
card.
no. But I'm saying you're a citizen of Canada.
I'm a citizen of Canada, but if I go back, I have to quarantine in a hotel for 3 days, then quarantine at home for 2 weeks, and
Yeah.
pay like $3,800. So it's just kind of annoying.
Listen, I hear you. Even I finally, my parents are just in Florida, and it wasn't until January that I went to see them because New York had very, very strict quarantine rules coming back. And I know a lot of people don't follow them, but we're rule followers in this house, is what my husband said. So I'm not, but he is. Um, I was like, "What?" But in that, you have to be. And I know that it was so hard. So
Yeah.
finally, when they kind of eased up on some of the restrictions, but when I went to see them the last time, it was same thing. I had to get a test 3 days before. As soon as I landed, I got a test before I saw my parents. So that was like another 2 days, and then I had to get one in Florida again 3 days before I flew back, and then
Yeah.
here.
Yeah. Yeah, I feel like, but this is gonna last for a while.
Yeah, I know. I know,
Yeah.
but
Sure.
you know the yeah, I yes, I agree. You know,
100%, like 100%. I was talking to my friend about it, and it's gonna get better in the summers, sort of like flu season almost, but this is gonna be it's gonna be a cycle like this for a while.
yeah,
Unfortunately, I'm sorry to be depressing.
you're not depressing. Well, you know what? I'll tell you. In case anybody is watching this right now and is like, "What the hell is going on with your hair?" I went to the salon today to go get my first keratin. Actually, that's such a lie. I got a keratin last summer too. But to go get the first keratin of this season. And I'll tell you, New York is bumping right now. I mean,
Yeah.
I think that people are going to be having, have you heard me say this before? Everyone listening. I think people are going to be having sex on the streets in this summer. I do.
Just because like everyone's like excited to get outside.
Yeah, and now we have all of these outdoor, you know, areas to hang out. So if you go
Yeah,
up 2nd Avenue, it's just bar, 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 bar. So in the city, you used to kind of if you would bar hop or restaurant hop, you were still having to go inside. Now it's very almost I don't want to people in Europe are going to be like, I mean, it's not Europe, but it has that sort of European
I love.
vibe
Yeah,
to it.
I love the way it is in the sense that like I love sitting outside now to eat. I don't think I could ever go inside again. It
Yeah.
feels so dark inside now.
Yeah.
Um, but I mean, I came to New York in February to set up my new office, and there was outdoor dining and it was a storm and I went and I ate outside. That was freezing, but I did it.
You don't know how many dinners I had this winter where it was like hat, coat, gloves, and like a full like I looked like I was gonna go skiing because that's how you had
Yeah,
to dress knowing it's like
yeah.
2 pairs of pants and,
Yeah.
yeah, but now hopefully it's gonna be nice and warm and wonderful, and congrats on opening a practice in Soho is what you said, right?
Yes.
That's amazing.
Yeah, I'm excited about it. I like it. I People in New York are actually like very cool. And they everyone wants aesthetics everywhere. So it's great.
Can I tell you before, actually last year in I think June, the second that they opened and they were like, you can go back. My first 2 appointments were one, my dentist, because I'm a teeth nut. And
Me
then
too.
I went right from the dentist to go to my dermatologist to get Botox.
That's amazing.
It
That's
was, I was like, but here's actually now that I have another doctor on here, I know that they say Botox lasts between 2 and months and up. I find that I'm at like the 2-month mark now. Is that like
you feel like it started you were it would last longer and then it started lasting less, like less and less over
yes,
time. That can happen. So there's like many different explanations for that. And I don't think that it's one reason. There's many different reasons. The first one that I feel that most people fail to notice is that we're aging every single day. So
right.
if you bought, let's say, like 20 units like a year ago, even, or like 3 years ago, you're certainly going to need more today than yesterday. There's a lot that we can do for prevention to slow the aging process, but the reality is we're still aging and there's lots of things you could do to help prevent it or slow it down, but it's still going to happen. And the other thing is occasionally, very rarely, people can develop resistance to these neurotoxins, and there's different ones that are on the market available. I always say that if you feel that one isn't working as well, maybe try another one.
Right.
And the two that I mainly use are Dysport and Botox.
Right.
But there are a few others on the market that I don't offer in my practice, but I mean, they,
Maybe I'm going to switch it up to Dysport. We'll see. I also have another theory too, because the last time I went, my derm was like, a lot of my patients are saying that. And I almost wonder if it is sort of the Peloton, I'm going to call it phenomenon, right? Because we're all exercising a lot more and maybe metabolizing it faster.
do you have the Peloton?
I
I
do.
love the Peloton.
Obsessed. All for the cookie. That is my name.
All for the
um,
cookie.
all for the cookie because that's
I
exactly I don't lie. I work out so I can eat more.
Oh my goodness. I And then when you work out, you need to eat more because you're burning so many calories. So it's just like kind of like the cycle. Um, but I love the Peloton. That is such a great
It's
little
been so
bike.
great. But people are like they say like knee injuries are up a lot more because now that everybody just has it in their house, people are doing it a lot more and not giving themselves time to recover. So my little wheel started turning and I was like, I wonder if it's the Peloton phenomenon that we're all like now, instead of like where you would maybe do 2 or 3 spin classes in a studio a week, now you're doing it, 5, 6, 7 days a week. Um, anyway,
That could possibly be because if you're boosting your metabolism by exercise or anything, to really boost your metabolism, that can help. That can increase you metabolizing the toxin.
we're talking today about threadless. It's something that I feel like a year ago, I started hearing about threadless a little over a year ago. And at the
Yeah,
time, I would be interviewing so many doctors, and they're like, we're not touching it. And now it's everywhere and everybody's doing it. And you are a big fan of it. In fact, do you want to share it? No. Well, you're a big fan of it, aren't you?
I am a big fan. Did you say you wanted to share that I was getting threads today?
Yeah. I was like, I'm not going to call you out.
I'm literally not shy about that. I don't care.
Yeah.
I'm very open about every procedure that I get done,
Yeah.
and I am getting threads today.
So, who does you well,
A little bit, just a little bit.
let's talk about for people who don't know what threads are, can you start by like what are they?
So, um, it's suture material. It's the same material that is used in the operating room for like years and years by surgeons for suturing up, and your body absorbs the suture. And in the 90s, there's a doctor, and I believe he was in the country Georgia, and he came up with the idea of using these sutures for aesthetic purposes. And so that's what was done. And the reason why there's been criticism of threads in the past is because from the 90s to 2021, there's been significant changes in the threads,
Sure,
the
right.
quality, the technology. So there's even permanent threads out there that I would not recommend to anybody. They're available in Europe, but a lot of this stuff is not available in the United States, which is good because some of it is not that great. But the threads that I use are top of the line quality threads that the technology is so amazing. The threads that I specifically use are from South Korea. And
And these are the PDO threads?
yeah, so PDO is just the name of the polymer. So it's
Okay.
just like chains of sugar chains that come together, make this thread, and your body absorbs it over a period of 6 months.
And I just want to stop for a minute because I want people at home, if you're thinking threads, it's not like a needle and a thread, although it actually kind of is, but imagine like almost a very thin piece of plastic. It's not plastic, correct? But
Right.
we're going to talk about that has like little tiny itty bitty spikes on it, like barbs.
Right. Exactly. And so
Okay.
not all threads are created equal. So there's different brands out there. They're not all great.
So like let's talk about it before we get into this. So cuz I've heard of Nova Threads, I've
Yes.
heard of PDO, which isn't that like a brand?
Well, no, PDO is just the type of thread. So
Okay.
PDO, there's PLLA. I use PDO threads only. I like them. I'm super happy with my results. I feel like there's a lot out there, but I'm just going to stick to what works well. And so Nova Threads make mainly PDO as well. I use Mint threads, and
Okay.
they're all PDO. It's a company from South Korea. And there are other companies out there. Some have some sort of FDA approval to be used in the United States, and some don't. And
Do,
around the
do,
world, there
do
are
you know the
hundreds.
ones that don't?
I
Not
mean,
offhand. You
you have to talk
okay.
to the company, and also, I mean, the issue about all of these threads is the FDA approval is for like a certain specific procedure, and a lot of things that we do in the aesthetics world are off label.
They're off label, right? Sure. I know.
I mean, I don't know if I should be saying this, but
No, no, no.
they're
Listen, my audience is educated and people need to know this. It's not that you are breaking any laws. It's just that the
no,
FDA has, for example, last a couple weeks ago, we did something on this new thing called Quo. Quo is
Yes,
this injectable for
yes, yes,
cellulite, but it's
yes.
really only FDA approved for the buttocks. But the doctor I was talking to, who was one of the investigators for the FDA
Yeah,
trials, I mean, who is a master in this stuff, has been doing it in the thigh. And he was very clear, or at the back of the legs.
yeah.
And he was like, I just want you to know, like, this isn't off-label usage. So I think people know off-label.
I mean,
Um,
so yeah, quo. I mean, I'm not sure if that's something I want to ever like. I feel like I just like Sculptura in terms of like for helping cellulite because that helps enhance it as well. But anyways, we're getting off track because I have
yeah.
opinions on all this stuff.
Oh, good. I'm gonna ask you that afterwards. So,
Okay.
okay, in terms of the so you like the Mint PDO threads,
Love
and
them.
you love them. And have you
Love
seen so, like, who would you say is a good candidate for the Mint PDO threads?
them. A good candidate is someone that wants a more natural, rejuvenated appearance. Um, with someone who's somewhere in their late 20s to like 50s. It's a big range, but basically the threads, what they do is you put them in usually the subdermal area, subcutaneous area, and they stimulate collagen. So the younger you are, the more you'll stimulate collagen, but the less you actually need the procedure.
Sure.
um, Someone who is good with following post care instructions, that's really important, because you want to ensure that you get the best outcome, and a lot of it is in the hands of the patient. Like, are you taking the proper supplements? Are you giving yourself time to heal? But if you've already gone to the point where your skin is too lax, too
Right.
many wrinkles, you might not get the best results. um,
Right.
or if your face is too chubby, if it's difficult to really see beyond like the fat in the face, then you might not be a great candidate. If you have any chronic medical issues, you might not
Right.
be a good candidate. But overall, I'd say a lot of people are good candidates. And I would really, if you're interested in threads, I would see somebody who, does this on a regular basis and, talk to them to see if you are the perfect candidate.
You see, I grew up, so my mother is always grew up going, what do you think if I just and for people who are only listening right now, she would kind of like push her cheeks up. And essentially that's what this is. This enables you to essentially put in a thread. Like, where do you like insert them around, like near the ear or the upper cheek
I
or
mean, many locations, but a lot of times I do go in through the lateral side of the face, closer to the hairline,
right?
and really pull up.
And then they literally kind of stick a needle or
Yeah.
let me tell you, if you are at home thinking about doing this, I might not YouTube it because it looks horrific. It really does. But the results I've seen, so a woman that I work with had them done and I was like, "What did you do?" Because prior to that, filler, especially on very she's very slim,
Yeah.
and sometimes the filler, it's like it wasn't it wasn't as good, right? Because she doesn't need it would I think I'm very slim people and also kind of like, well, I guess you're right. It kind of works for everyone, but it looked phenomenal. I'm kind of getting tongue tied here, but she looked so good. And I was like, what did you do? And she shared with me, it was very natural. I saw her literally right after they were done. And aside from her then pointing out like a few little of the injection or entrance areas, points, you couldn't tell.
Yeah.
And she went out to dinner that night.
Yeah, I mean, people swell differently because it is a procedure still. I tell people, and there is a little bit of downtime in terms of swelling. So some people don't swell at all,
Right.
and some people will swell. And really, it's dependent on many factors. But the downtime relative to a surgical procedure is a lot less.
Mhm.
Um, and within a month, the threads really settle, and you start stimulating the collagen, and you really see great results. And I love it. I'm so
Well,
excited.
because it's also kind of an instant you see the results almost instantly, correct?
You do, but I'd say within a month is like the maximal results.
Okay, so like we're coming into the summertime and wedding season. So this is something that if you had a mother of the bride or even a bride herself, you might say, do this a full month out.
A bride and a mother of the bride, I would say do it like 2 to 3 months out,
Yeah.
and in case they need like a touch up.
Okay.
Um, but I always tell, brides to do things like plan a year in advance, because
Yeah.
like you
Don't
really
do
want to.
things.
Yeah,
No.
you don't want to do things a month before. Like,
Fair.
what if you're not happy with something, then you don't really have time
Fair.
enough to like change it.
Fair. Yeah,
So,
you're so right. I mean, right before I got married, people were like wanting to give me all, and I was like, no, thank you. I know better. Um,
yeah.
So I do want to talk about this though, because like I said, I have personally seen stunning results. And but I've also heard a couple things that maybe you can talk about. I heard that, when you're building that collagen, one of the I read somewhere that one downside to threads is that it is causing sort of these little micro tears within the body, within the face, and that if you were to continue to do it for a while, later on in life, if you wanted a facelift, it might
Yeah.
be tough because of the scar tissue.
Um, so I've heard that a lot too. With regards to patients that I'll do repeat threads on, I haven't experienced scar tissue.
Okay,
Um, but I don't think it should really interfere, um, because I just don't think it will, based on my experience. I have to like look at the studies. I don't think the studies are that great out there with regards to that. But
sure.
I don't think that should prevent you from getting it, because I have patients that I do procedures on that do have scar tissue, and you get scar tissue from facelifts too. Like, I did threads on, and I must tell you that facelifts aren't permanent either. They last 5 to 10 to
Yeah,
15 years, and so after that, some people do repeat facelifts. They'll do other procedures. So I've done threads on patients that have had facelifts, and they'll have scar tissue as well. But it's also like the doctor that's doing it has to be experienced to know how to handle. Because
sure.
I do threads on patients with scar tissue from other reasons, because I don't know if you've heard of Sculptra. That product can cause scar tissue, Sculptra. And I love it though. And I am able to still do my procedures. So it's also the level of experience of the person who's doing your procedures.
Sure, matters. And so does, I mean, especially with threads. You said it before. If you're thinking about doing this, you want to find somebody, ask for their before and afters, make sure that they're doing a lot of these, because, like any other thing out there, so much of this is really in the hands of the provider and provider dependent.
For sure, 100%.
So, what about for like, I'm a side sleeper too. So, I'm wondering, like, is that,
Well, in general, for beauty,
it's terrible. You
you
should be a
should,
back
or
sleeper.
even for health, you should be sleeping on your back. It's better for us to sleep on our back for many different reasons. And so there's this thing that I like, the beauty pillow. It has like an indentation where you put your head in it, and it helps you sort of like not move. I suggest getting that, especially
Mm.
after the thread procedure, so you can like sleep facing up.
Um, yeah. Uh, I I had my boobs done, and, like, that's just, like, the most painful thing, and I was sleeping on a wedge, and I will still roll over on the side of the night. So I just
Right.
it's a comforting thing. I wish I probably just should get some straps on the bed and just hold myself down,
Yeah,
but, uh
strap yourself down.
do you feel like, so I feel like we talked about, what they are, the ones
Yeah,
that you like, which are the PDO.
yeah,
You mentioned that there can be a little bit of downtime. It is very provider dependent, and you're
correct.
seeing the age range from like 20 to 50, and maybe actually post
Even
50 if you're
older,
doing
even
it as like
older.
a touch up to a facelift,
Right,
right?
absolutely.
Is there anybody who you feel like should not be getting these?
Well, I kind of went over that a little bit before, but really somebody who has like unrealistic expectations of what the procedure
Mm,
is about. Because it's a very natural result. It's not a surgical result, which I think is great because I like the more natural look in my opinion anyways.
Sure.
Uh, Someone who is not going to commit like proper post care.
Right.
Like I
And then
said, someone who might have mm,
I didn't ask you, how long does it last?
approximately a year. I mean, you're stimulating collagen, so that collagen that you stimulate should last about 7 years. But we're aging every day, so you're fighting with time, and time is always going to win. So approximately a year. But let's be honest, I think I'm getting threads today, and the last time I got them was I think in November. But I just want them.
You want them. Listen, I get it.
I just
Listen,
want them.
certain things, it's a slippery slope. I did Ulthera. I love Ulthera. Ulthera is a very
Yeah.
slow, it's a slow burn, but I went back this year and I was like, sign me up again. Let's do another round. So I get it. And Botox, I feel like I was just there 2 minutes ago and
And you'll
I'm
be
going
back.
back. They always come back. So last question. Uh who like do you do your own threads?
Um, no, I'm gonna
Okay.
have my nurse do it. I train my nurse. I do a
Okay.
lot of trainings actually. I train other nurses, doctors, nurse practitioners, PAs in threads, and other procedures too. But um, I trained her and she's certified and she's great. So she's gonna
Amazing.
do it on me.
And then, actually, before I let you go, there have been some things. Like, let's talk about some of the things that can go wrong. You can get in the hands of a inexperienced provider, or if you don't follow the proper care. I've heard that you can get like a little rippling. Is that true?
Yes, that is again multifactorial. If you don't follow good post care, that can happen. It could be, the provider, also like not doing the right injection, like the injection depth, or positioning it properly. So thankfully, it's not permanent.
Right.
So it will go away.
Can it be? Can they? Like if you can dissolve filler ish. Can they undo it? So if you went and had a terrible job, is there any way to undo it, or eventually it just is going to undo itself?
Um, so there's ways to dissolve it and there's ways to remove the threads. I mean, you do not want to like get in there and like try to remove a thread. That's like worst case scenario. But you can do with like invasive radio frequency, you could do
Mm,
solve a little bit.
sure.
But yeah, I usually say time, give it some time.
And then, like, how I know this varies so much for patients, but on average, because and we also know that prices vary depending where you are in the country,
Yes.
but can you give us a ballpark on the pricing and if it's done like by thread or by area?
I usually go by area, and
Okay.
it goes anywhere from like 1700, 2000 to like 4,000. It depends on like what areas you're doing. We can also do threads on the body too. So I do like in the buttocks area, like to help give it a little bit of a lift in the thighs and the abdomen, especially for women who've given birth before. It looks really nice in the tummy. You're funny.
I am like,
You're
wait
gonna
a
love
minute. Where can I stick them in my body?
the other thing I wanted to mention is like we have advanced so much in technology that like now the options like back in the day were like you just age and then you get a facelift. And now
Right.
it's like there's so much you can do. So it's time for people to start embracing all the technology and using it to their advantage.
I am, and, I think I like, that's how I look at, like, Ulthera, and I look at Botox. When I remember 20 years ago when somebody was like, "Get Botox, it's preventative." I was like, "You're a liar." And now I'm like, "Yes, it is," and I didn't start
Yeah,
until I was 35.
nice.
But I feel like it is definitely, if you can't make the muscle, then you're gonna do this, and with thread lifts, I think that you are, again, if you're building the collagen, same thing with, Ulthera, right? You're stimulating collagen. Your hope is not maybe that you'll never, well, I mean, the hope is kind of now that maybe you'll never need a full facelift, but that you can kind of take these little measures to at least maybe push that off.
Exactly. I
And for
mean,
some people who might never need it.
my goal is to never have one. Um, because like who really likes that facelift look? But we'll see. We'll see.
We'll
I mean,
see.
if it gets to the point, I might just have to get one, but I'm just gonna do some threads and
You're
we'll
gonna
see.
just keep threading, keep threading. So, Dr. Rahi, thank you so much for being on. If people want to find you, bi-coastally, I love this now. What's the best way to look you up?
Um, Instagram is great because you can see a lot of my work. I have a
Okay.
lot of befores and afters. So it's Dr. Rahi MD, but it's doctor spelt out.
Okay. So
And then
DoctorRahimD.
exactly, exactly.
Okay.
It's, it's spelt out so long. People always think my name is Dr. Rahim, and I'm like, no, it's Rahi, Rahi MD.
MD. I just wanted to spell it because some people might be like RAHY. No,
Right,
RAHIMD. And then,
exactly.
what's your practice website?
It's drrahi.com, and it's just Dr. Rahi spelt out again. And you can just email us, call us, message us if you want to see me in LA or New York.
And New York is open for business?
Yes, I go
Oh
there
my
once
goodness.
a month. I mean, I've been going there for a year now. I love it. I initially did it to be closer to my family in Toronto.
Okay.
Now the borders are closed, so I'm just going back and forth.
Gotcha. I'm sorry. Well, soon. I'm hoping that it's going to open soon.
Yeah, me too. I hope
I
so
want
too.
to. I've never been to Toronto. I hear it's well beautiful, and also Quebec is like those are the two. Quebec City.
That's beautiful. Vancouver's beautiful. Canada's just beautiful.
It is beautiful. It is
Yeah.
beautiful, and it clearly breeds beautiful, beautiful people. So thank you
Beautiful.
so much,
Thank
Dr.
you.
Rahi. And of course, if you guys have questions that you want me to pass on to Dr. Rahi, always happy to do that. Email me at hello@artbeautypodcast.com. You can find us on Facebook, Instagram, and of course, YouTube at Art Beauty Podcast. And as always, we will see you next Tuesday. Bye.
Thank you. Bye.